please stay on mute throughout the webinar, and we will open it back up for question and answer towards the end, provide you all with an opportunity to ask any questions, but in the meantime, please stay on mute. So without further ado, I would like to turn it over to Marianne Cooney. After I give her a brief introduction, she's our first presenter here today. She will be introducing our other speakers, Zenobia Harris and Jennifer Cooper. Marianne Cooney is Chief of Health System Transformation at ASTHO. She oversees and provides strategic direction for the areas of public health integration and transformation, public health law, health equity, and public health informatics. Marianne previously worked for 14 years at the New Hampshire Department of Health and Human Services. From 2003 to 2008, Marianne was the director for the agency's Division of Public Health Services. In 2008, she was confirmed as Deputy Commissioner, and then in 2012 was appointed Associate Commissioner for the agency. In this most recent role, Marianne provided leadership and oversight for the 8 divisions across the agency. Marianne, in fact, began her career as a registered nurse working in the intensive care and cardiac settings. After assisting clients in their recovery from heart attacks and strokes, she changed her focus to public health, where she could bring prevention strategies and policies to school-aged youth in Manchester, New Hampshire. Public nursing and a passion for community health became the career path that led her to ASTHO. Without further ado, I'm going to turn it over to Marianne. But first, I'd like to get as a final housekeeping note for all the folks who have just joined us during the introduction. As a reminder to please mute your lines until the question and answer session. So thank you. Without further ado, Marianne Cooney.
Thanks, Doug. I really appreciate it. Hi, I'm Marianne Cooney, and as Doug said, I'm from ASTHO. I've been here for about 8 months, and have been really enjoying my work here, and especially the work related to health equity. So just a little bit about ASTHO for those of you that may not be familiar with it. ASTHO is a national nonprofit organization representing the public health agencies of the U.S., the U.S. territories, and the District of Columbia, as well as more than 100,000 public health professionals these agencies employ. ASTHO members, the chief health officials of these jurisdictions, are dedicated to formulating and influencing sound public health policy and to ensuring excellence in state-based public health practice. At ASTHO, health equity is part of the health systems transformation team, but is woven through and visible in most, if not all, our teams and department work. ASTHO's Health Equity Strategic Plan's central challenge is to mobilize leadership to achieve health equity, and its 4 objectives are foster societal understanding and the will to achieve health equity. Second, leverage and engage broad public-private partners in health equity solutions. 3, leverage existing and new funding for health equity. And 4, strengthen organizational effectiveness in support of health equity. A cross-cutting strategy addresses the root causes of health inequities as well as measurement and evaluation. The most recent examples of that strategy was ASTHO's President and Minnesota Commissioner of Health, Ed Ellinger's 2016 President's Challenge, Advance Health Equity and Optimal Health for All. I invite you to visit our website to check out some of the materials that were generated during that President's Challenge. We seek to empower states and territorial health agencies to take up this effort via the 3 objectives of the triple aim of health equity, very similar to the triple aim of health care, implementing a health policies approach with health equity as the goal, expanding our own understanding of what really creates health, and strengthening the capacity of communities to create their own healthy futures. Other projects have included webinar series in 2014 and 2016, minority health surveys in 2007 and 2010, and in 2011, a national prevention strategy toolkit. As well as in 2013 we published a health in all policies toolkit. These webinars, surveys, toolkits, and more were intended for use by states and other agencies to assist in their health equity efforts and are available on the ASTHO website. I'd now like to introduce and turn the presentation over to our two great speakers today from the Association of Public Health Nurses. I just want to tell you, I have been a member of the Association of Public Health Nurses in the past, and in my own work in New Hampshire had tremendous relationships with the public health nurses, especially those in New Hampshire in the communicable disease and the areas of surveillance and immunization. It's those relationships that I learned just the power of public health nurses and how important they are to the fabric of the communities in which they live and in which they work. Zenobia Harris is Executive Director of the Arkansas Birthing Project. She's worked for over 35 years in varying roles at Arkansas Department of Health, most recently as a Regional Public Health Director. Zenobia earned her Doctor of Nursing practitioner in public health nursing at the University of Tennessee Science Center, the College of Nursing in Memphis, Tennessee, her MPH degree at the University of Alabama, the College of Public Health in Birmingham, and her Bachelor of Science in Nursing degree at the University of Arkansas for Medical Sciences College of Nursing in Little Rock, Arkansas. She has many professional affiliations, including currently serving as Robert Wood Johnson Foundation's Interdisciplinary Research Fellow and serving as a Director in Diversity and Social Equity Committee Chairperson with the Association of Public Health Nursing. She's interested in research involving low-cost approaches to addressing health inequities in local communities. Our other speaker is Jennifer Cooper, and she is the project manager for the Association of Public Health Nurses, where she leads a variety of projects related to chronic disease prevention and management. She is an assistant professor of nursing at Hood College in Frederick, Maryland, and previously taught public health nursing as adjunct faculty at Georgetown University in Washington, D.C., and Marymount University in Arlington, Virginia. Prior to working in academia, Jennifer was a project manager at AARP for the Future of Nursing Campaign for Action and a program associate at the National Council on Aging, both in Washington, D.C. Jennifer is licensed as a registered nurse in Maryland and Pennsylvania and is board certified as a public health nurse. Her nursing practice has centered on older adults and community health. Jennifer earned her Doctor of Nursing Practice from the George Washington University and her Master's of Science in Nursing from Rush University and her BSN from Cedarville University. And it is now with great pleasure that I turn it over to Zenobia and Jennifer.
Thank you, Mary Ann. My name is Zenobia Harris, and I am with APHN. Jennifer, you're up here. We're excited today to be a part of this presentation, to work collaboratively with ASTHO on this important concern and issue, and also to have had the opportunity to collaboratively work with the APHN Public Health Nursing section on this presentation as well. For those of you that aren't really familiar with APHN, our vision is to promote healthy communities through excellence in public health nursing practice and leadership, and we want to shape the role of public health nurses within the specialty of population health and educate and advocate for policies and practices that advance the practice of public health nursing, promote public health. And I represent for APHN the work group that we have on diversity and social equity. Jennifer?
Hi, Zenobia. Thank you for the introduction. Can I have the next slide, please, after my picture slide?
Mm-hmm. Oh, I'd like to show you the other collaborators on this presentation. Susan Coleman with the APHN. She's also with APHN, the Diversity Committee, and she is a member of APHA's PHN section as well. Dr. Lisa Campbell, who is the PHN section president for APHA. And May Duvall, Dr. May Duvall, who's also with APHA PHN section, want to again thank them for their collaboration on this presentation. So we're going to talk about a little bit about the health equity background. Many of you, all of you, are probably very familiar with what equity is. Then we're going to discuss some of the state public health collaborative efforts with public health nurses that are occurring around our country. And again, refer to some of the publications and resources that are out there regarding this subject matter with any contact resources. The objectives of this presentation are to highlight the involvement of selected public health nurses in promoting health equity in various initiatives and programs of national significance in the United States, illustrating the significant role that public health nurses have in identifying and improving the conditions that shape health and promote health behaviors, and to demonstrate how state and local public health institutions can utilize the experience, knowledge, and skills of public health nurses in promoting health equity and, of course, promoting a culture of health. So to talk about health equity, a little bit about the background of it, I think it sets the stage for our discussion this afternoon regarding health equity. So public health nursing, as you know, is the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. And that's the definition that APHA and the PHN section identified back in 2013, in which they advocate.
Excuse me, Zenobia, I just want to remind everybody to please put their phones on mute. We're getting a little bit of background noise. Please assure that your phone is mute. Thank you.
We know that most nurses care for one patient at a time, but public health nurses are unique in that they care for entire populations at a time. They work with whole communities. They're able to educate people about health issues, improve community health and safety, and they help to make sure that we have increased access to care in our communities around our country. They monitor health trends, identify health risk factors. They educate and provide direct health care services to vulnerable and at-risk populations. And they believe that a person's health is affected by many things, including their genetic makeup, their lifestyle, their environment. And instead of waiting for patients to come to them, public health nurses seek them out in their communities. We go to communities to try and help people improve their health and prevent disease. And we also believe that health education is a primary focus of our work. We draw on our training to give people reliable information about how to protect their health. And we present in schools, community groups, senior centers, other groups across the country, explaining about nutrition and other important health issues. Our goal is to make health information easy to understand so people can take greater control over their own well-being. We work in low-income and rural communities, urban communities. We provide critical health care services. We immunize children. We provide prenatal and well baby care, and we teach the elderly how to stay safe and healthy in their homes. We also work in various communities and various agencies, governmental agencies, nonprofit groups, community health centers, and other organizations that have the aim to improve the health at the community level. We work alone, or we work with multidisciplinary teams, and we offer supervise other healthcare professionals and laypersons in the healthcare arena. In addition to working with communities, public health nurses also work behind the scenes. They plan activities, they manage budgets, they evaluate the effectiveness of public health programs, and they may even travel locally or across distances to meet with community organizations to bring healthcare services to communities which need. As we talk about health equity, we'd like to talk a little bit about what our definition of health equity is, being, of course, an ideal state that's marked by fairness and the achievement of optimal health and well-being for all populations. Public health nurses are strategically positioned to promote health equity in the populations that we serve. We have historically addressed health equity in our practice in our communities. Health equity and social justice advocacy is embedded in the practice paradigm of public health nurses. When we talk about health and equity, we believe that health should be in all policies. And to quote Dr. David Williams here, housing policy is health policy, educational policy is health policy. All policies in our communities is a part of health policies. And we believe very much so, as Dr. Williams has stated, in unnatural causes, that there should be health in all policies that are created in our communities. One of the signature things that the Association of Public Health Nurses has done is to author several position papers that talk about the involvement of the public health nurse and the strategic involvement that we must have in partnerships and communities in order to promote the future health of our communities. We believe that public health nurses are educated, highly skilled, and very cost-effective partners when we talk about increasing the opportunities for improving the health of communities. The Association of Public Health Nursing has also further defined its commitment to diversity and social equity by establishing a committee on social equity and diversity, which is promoting the work of diversity and social equity within the confines of the organization and also within the confines of collaborative relationships, such as that which we have with ASTHO and with the APHN Public Health Section. And so we continue to work on furthering what we believe is our responsibility to promote diversity in our APHA Public Health Nursing Section also has a similar vision regarding promoting health equity. We believe that their strategic vision is focused on health equity because it ensures social justice and eliminating health disparities, strengthens the public health workforce, actively engages students, and promotes environmental health. APHA Public Health Nursing Section also has a Diversity and Social Justice Committee, and that committee works in conjunction with PHNs and with APHA and other disciplines to promote health equity, assisting membership committees, planning and conducting activities to increase opportunities for Public Health Nursing Section members to develop knowledge and skills, and planning and conducting activities to increase knowledge and skills in the section members as they address issues of equity and inequality and social justice in their local communities. When we talk about health disparities, we also have to look at the financial cost of health disparities to our communities. We know that the disparities in healthcare cost about $60 billion annually. We know that racial health disparities are associated with substantial annual economic losses, including an estimated $35 billion in excess healthcare expenditures, $10 billion in illness and related lost productivity, and nearly $200 billion in premature deaths. We know that coordinated efforts to reduce health disparities could have profound economic value to our communities and our society, including reducing days lost from work, reducing excess illnesses and disabilities, and, of course, reducing excessive deaths. So we think it's an important investment to promote health equity and the decline of health disparities. Now, everyone has probably seen this slide, the example of equality versus equity where the children are standing at the fence. And the three children are, of course, different heights. And if each of them are given a similar box, the same size box to look over the fence with, the shorter child won't be able to see over the fence at all and so won't be able to fully participate. Well, that's equality because they all have the same size box. But when we start talking about equity, we're talking about providing the remedies that will enable the shorter child, the child who can't see over the fence, to see over the fence as well as all the other children so they can fully participate in the enjoyment of the game as well. And that's true in regards to health equity, doing things, promoting conditions to make sure that everyone has an opportunity to fully enjoy the benefits of our society. At this point, I'd like to talk about some of the state public health collaborative efforts that public health nurses are engaged in across our nation as we talk about and highlight the work of public health nurses in this arena of promoting health equity. The programs I'd like to highlight today include environmental health programs, Million Hearts, the Health Disabilities Management Movement, HIV/AIDS outreach, the Robert Wood Johnson Public Health Nurse Leaders Group, the Public Health Nurse Preparedness work that is going on across our country, and the Nurses on Board initiative that is taking hold across the nation as well, involving nurses. Within environmental health, I'd like to highlight this very important effort that's going on at the Mid-Atlantic Center for Children's Health and the Environment at Georgetown University in Washington. This program is a very unique air quality indicator program that's been implemented in schools and other community locations utilizing the skills of public health nurses and school nurses. This environmental health program, called the EPA Air Quality Flag Program, has been implemented by Dr. Laura Anderko, who has spearheaded an alliance between school nurses, universities, and other organizations in the Washington, D.C. area to utilize this air quality program to protect the health of those with respiratory illnesses such as asthma, bronchitis, and chronic obstructive pulmonary disease. This program is funded in part by a cooperative agreement from the Agency for Toxic Substances and Disease Registry. Dr. Anderko is a Robert Wood Johnson Executive Nurse Fellow, and she serves as research co-chair for the Alliance of Nurses for a Healthy Environment. She's co-chair of the National Environmental Health Partnership Council, and she's chair of the National Center for Children's Vision and Eye Health Advisory Board. Now, this program is unique in that it uses brightly colored flags based on the United States EPA's Air Quality Index to notify people in the communities regarding outdoor air quality conditions. The organizations raise a flag each day to reflect their local air quality forecast and to promote public and community awareness of daily air quality. So this program brings public awareness to outdoor air quality conditions, and it promotes creative thinking strategies to keep safe when the air quality is not optimal for children, teenagers, adults, and the elderly. It also brings awareness to individuals with reactive airway diseases and allergies to take safe precautions on those days where there's high sensitivity and high pollutants in the air. Our next emphasis is going to be, our next programs, several programs will be discussed by Jennifer Cooper. Jennifer?
Thanks, Zenobia. And thanks for giving me the opportunity to share a little bit with you about two of the projects that APHN is working on right now, the Million Hearts Initiative, and also I'll talk to you about a DC breast cancer project that we're involved with as well. But Million Hearts, hopefully, thank you for that slide, hopefully you've heard about Million Hearts. It's a CDC CMS initiative that was started in 2012. And the goal of the program was to prevent 1 million heart attacks and strokes by 2016. So APHN has been very fortunate and very grateful to be an affiliate of ASTHO, and we're a national partner with them within their Million Hearts State Learning Collaborative, which started in 2014. So we are now in year 4 of the State Learning Collaborative, which has involved 22 states who are creating practice and systems change to improve the identification and management of hypertension. So we're really focused on blood pressure, identifying people at risk or with hypertension to hopefully prevent those heart attacks and strokes, as many as we can. APHN's role in the Million Hearts State Learning Collaborative, like our mission and vision, has been to be the voice for public health nursing within this initiative. And we've done this by providing technical assistance to the state teams and trying to really reach down into the state teams and find out who the nurses are that are working within the teams and make connections with these nurses to other nurses in other states. And we really do this and want to show the value of their work. So on this slide that you're seeing here, I organized APHN's contribution to Million Hearts into the 3 areas that relate to the mission and vision of APHN in shaping that role of public health nursing in practice, leadership, and in advocacy. When we think and apply this to Million Hearts, community assessment is one role of public health nurses, and it's a way we can bring together our clinical knowledge as nurses, but also the knowledge we have of the social determinants of health. And sometimes really looking at these social determinants is a way to uncover and address the inequities that exist in our communities. So within Million Hearts, we hope that community assessment would include identifying people that are at risk for heart disease and stroke. And we've been doing this by within the State Learning Collaborative by identifying those who are undiagnosed, which Million Hearts likes to say, those who are hiding in plain sight, and looking at the social determinants of health. So what are the social factors that are putting people at risk where they're not getting screened and monitored or following a treatment regimen for high blood pressure? So nurses in the community have been really strong partners in providing health coaching and monitoring related to hypertension. I think one of the keys to eliminating some of the disparities that we see is to have the right partnerships in place. And that's where the leadership comes in, is developing the partnerships, the people that sometimes are the best to reach into the community that they're working with and the population they're working with. And public health nurses are developing these partnerships where they can develop trust with their population and then lead practice and systems change that are promoting equity among the people that they're serving. An exemplar of this I just want to mention is within Million Hearts is public health nurses collaborating with faith community nurses. There are several states really with exemplars where they've extended their reach into the communities where people are most at risk because of these partnerships with the faith communities. And finally, APHN advocates for the role of public health nursing and for the health of populations, both which we feel are critical to tackling such a big problem like heart attack and stroke prevention. And if I could have the next slide, please. One of the newer partnerships we just established is with the American Association on Health and Disability. The American Association on Health and Disability works with the Susan G. Komen National Capital Region, and they've launched a breast cancer awareness project for women with disabilities in the D.C. area. So it's an innovative project that is an opportunity for women that have disabilities in the District of Columbia, specifically in wards 2, 5, 7, and 8. And it's also an opportunity for us to connect with mammography facilities to look at accessibility issues related to getting women in there to have their mammograms done. Most of us know women with disabilities are a medically underserved population, and they're at an increased risk of breast cancer mortality. And they're less likely to receive a clinical breast exam and recommended mammography screenings than women without disabilities. So there's health inequities there that are due to physical, environmental, cultural, and attitudinal barriers that women with disabilities encounter as they try to seek breast health care. So our project attempts to decrease these inequities by focusing on the continuum of breast health care services among these women. So
please mute your phone.
We're trying to find...
The conference has been muted. The conference has been muted. The conference has been unmuted.
So this is Jen. ASTHO, should I continue?
Yes.
Sorry
Okay.
about that.
We did our best to try to get that accomplished, and we hope that people... Thank you. Don't put your phones on hold, please. Thank you.
Thank you.
So just in conclusion, APHN's role in this breast cancer management process is to provide 12 educational workshops on breast health within these 4 DC wards. And again, partnerships here are very important. I'm working very closely with a nurse educator, Dr. Gloria Jones of Howard University, who's helping us coordinate these workshops within DC so we can really reach these women and make sure they understand about breast cancer screenings and get to the appropriate facilities to have it done. So that is just a overview of our Million Hearts and our breast cancer project that we're involved in right now. And again, very happy to share that with you today. So thank you.
Thank you, Jennifer. Another important area that public health nurses collaborate for care in local communities is in the area of HIV/AIDS community outreach. I'd like to talk about this program in Texas that Dr. Lisa Campbell, who is also the APHN section president, has been involved in over the past few years. Dr. Lisa Campbell was the former director of the Victoria County Public Health Department in Texas, and when she took the helm in early 2015, the HIV/AIDS resource program didn't have a community outreach program. She knew that a community assessment needed to be conducted, but she had very limited resources, so she partnered with Dr. Jeff Watson from Texas Tech Health Sciences Center School of Nursing, who worked with her to conduct a survey of the 5-county HARP or HIV resource programs service area. Dr. Watson discovered that there were 2 beliefs about HIV/AIDS that could have an impact on the success of the community outreach program. One being the belief that people need more education to learn how to avoid getting HIV/AIDS, and the belief that people living with HIV/AIDS do not have a right to confidentiality about their disease. The most striking finding from their survey was the belief that individuals with HIV/AIDS do not have a right to confidentiality about their disease. Although there were limitations, including a very low sample size, the effect of the power of this study to provide evidence for broad application findings do highlight the importance of community beliefs when designing and implementing the community outreach program. When implications for testing, treatment, and disclosure, the right to privacy and confidentiality could not be overlooked as a cornerstone of programmatic planning. And so, together they reached out to the Health and Human Services Regional Resource Network Program in Region 6 on AIDS, and the research findings were shared, and as a result, a capacity-building workshop was developed entitled Addressing HIV Stigma in Latino Communities. The day was spent in thought-provoking dialogue, valuing the social norms and core values of the Latino community in South Texas. As a collective, the group developed strategies to target National HIV Testing Day, which they identified as June 27th in 2015, and they further worked toward a day aimed at National Latino HIV Awareness, which occurred on October 15th. The workshop was a collaborative effort. It was conducted by all the partner organizations, and the outcomes ultimately led to the development of the HIV/AIDS outreach program, which leveraged resources, which is a key strategy to ensure health equity for vulnerable populations. This is an example of what was done in Texas. Another exciting program that exists currently regarding promoting public health nurse leaders in our communities has been undertaken with the support of the Robert Wood Johnson Foundation. Public health nurses provided care and education in homes, workplaces, and community centers, and the foundation has offered community health nurses a 2-year leadership development program intended to strengthen the culture of health movement. Those chosen to be Robert Wood Johnson Foundation public health nurse leaders through training have become senior-level advocates, and they're able to lead efforts to coordinate individuals, organizations, and communities to build healthier communities. These nurses also work closely with their state nursing action coalitions, and they have a relationship that's mutually beneficial in providing a network of important key influencers for each to work with on building a culture of health. There are currently 25 public health nurse leaders from about 22 states involved in the Robert Wood Johnson Public Health Nursing Leaders Program. This 2-year program is developed to strengthen the capacities of these senior public health nurses. We won't have time to list everyone enrolled in the program, but we want to touch upon how important it is that we have the states of Alabama, Arizona, Arkansas, California, Illinois, Hawaii, Iowa, Kansas, Louisiana, Maryland, Minnesota, Mississippi, Nebraska, New Mexico, New York, North Carolina, all involved in this program, have nurses involved in this program, which gives us a very broad reach across the country having these senior nurse leaders supported in this way in order to be able to finance their research interests and also to ensure that we have, I think, strengthening our public health nursing workforce. The Alliance for Healthy Nurses in the Environment, or the ANHE, was founded in 2008, and it's had nurses from around the country join its work groups to participate in meaningful national efforts around education, practice, policy, advocacy, and research in the expanding field of environmental health preparedness. The education work group is developing curriculum materials for nursing schools. There's a practice work group that shares resources for nurses who are working on the green movement within their hospitals and other healthcare facilities. There's also a research group that's creating a compendium of nursing research articles on environmental health to better identify evidence-based practices to share with nurses around the country. And, of course, the policy and advocacy work group is addressing environmental health policies at the state and national level, helping to mobilize the nursing community to support policies that encourage citizen knowledge about potential health hazards through the right to know mechanism. The Nurses on Boards movement is another strategic influence on health that is occurring in our country. This is a conglomeration of the Association of the American Nurses Association, the American Academy of Nurses, and the American Nurses Foundation, which work together to increase nurses' presence on corporate and nonprofit health-related boards of directors throughout the country. The coalition implements a national strategy to bring nurses and their valuable perspectives to governing boards, as well as state-level and national commissions with an interest in health. The goal is to put 10,000 nurses on boards by the year 2020. This effort is a direct response to the Institute of Medicine's IOM report, The Future of Nursing, Leading Change, Advancing Health, which was published in 2011. This report recommends that nurses play more pivotal roles in boards and commissions in improving the health of all Americans. This effort is funded by the Robert Wood Johnson Foundation and AARP as part of their collaborative effort to implement the recommendations of the IOM report through the Future of Nursing's Campaign for Action. The goal of Nurses on Boards is to increase nursing participation, and all boards, we believe, or they believe, will benefit from the unique perspective of nurses to achieve the goals of improved health and efficient and effective healthcare systems at the local, state, and national level. Since its inception, 9 trainings have been held, and over 231 nurses have been trained. There are many other opportunities for collaborative efforts for public health nurses. Public health nurses can empower communities and populations to become more involved in community health promotion and prevention. This empowerment reduces health threats and increases health equity. As the role of public health nurses as advocates, collaborators, educators, partners, policymakers, and researchers evolve in the area of community health promotion, and as greater emphasis on community participatory and collaborative approaches in public health nursing and practice increases, we'll realize increased benefits for the public health agencies and the local communities that we serve. These practice settings take advantage of basic and advanced public health nursing practice roles and emphasize interprofessional collaboration, community participatory strategy, and the importance of local knowledge to address community health problems. These settings will continue to utilize the skills of public health nurses to contribute to improved community and public health outcomes. We believe that public health nurses are highly dedicated individuals who work very hard to improve community health and access to care. They work well with collaborative groups. They listen attentively. They're sensitive to cultural differences. They have to manage scarce resources in a creative way, and they have to focus their efforts where they'll do the most good. It is in the professional DNA of public health nurses to advocate for and tend to the needs of at-risk and hard-to-reach populations. Nurses continue to outrank other professions in the Gallup Poll's annual Honesty and Ethics Survey. PHNs recognize the moral imperative for promoting and seeking health equity. Health equity means social justice with respect to health. It's a reflection of ethical and human rights concerns such as discrimination, non-discrimination, and equality. For the public health nurse, health equity means equalizing opportunities in order for all communities to be healthy. Achieving health equity requires untiring efforts to seek and make improvements among those who are at the bottom of our social strata and at the bottom of our health ratings. We have listed here various references in regard to our presentation today. And we also have listed contact information, excuse me, for Jennifer and I. And now we're at the point where we can entertain questions or comments.
Okay.
Oh, goodness, Zenobia. I hope you go get a drink of water now, and thank you so much.
Yeah. Yes, thank you so much. We'd like to now open it up for questions. Please, feel free to take yourself off mute at this point and to ask a question over the conference line. And then put yourself back on mute. So please stay on mute if you're not asking a question. And when you finish your question, please go back on mute. But if you have any questions, now it's time to please go ahead and ask those.
So hi, my name is Sandra Robinson, and I'm here in Illinois at the Chicago Department of Public Health and a member of the Illinois Nurses Association. So we're trying to put on a conference during Nurses Week. We've asked President-elect Robin Hanna to be our speaker. And so our issue here in Illinois is that nobody's talking about the future of public health nurses here in Illinois. Our employer, which is the City of Chicago Department of Public Health, has not talked to us about it. And so, of course, nurses are, there's 40 of us, and we're kind of scared because nobody's talking to us. So it's very vital that we do this public health forum, and so that we can educate our nurses and the public as well. And so if you all have any suggestions, I think the biggest thing is that we're asking Robin to be our presenter.
Thank you.
Have you actually made contact with Robin, or have you not heard anything yet from her?
Yes, she did give us a date. She gave us May 6th. The other, we're waiting for her to, she's going to send us, she said something about she did a presentation in Ohio, and she was going to send it to us to review so that we can critique it, with our nurse educators so that it'll fit those of us who are in Illinois.
Well, that sounds like a good start.
Yes.
Do you have contact information for Robin?
Yes.
Okay, so you're giving her an opportunity to give you some feedback, and then you're going to reconnect with her?
Yes, so that we're in the process of trying to book a room, and, but we wanted to review the material before we, went any further. But I think it is there's a great deal of fear at this health department because we don't know what's going to happen to us. And it's very difficult to work every day when nobody's talking to you about your future. It just makes it difficult. But because we're public health nurses, our number one responsibility is to our patients.
Well, you certainly have hit upon a really strong point. I think there's some apprehension around the country regarding what's going to happen next in public health as a result of our recent election and some of the changes that might be happening in public health. So, and I think every time we have a change in presidential administrations, this kind of thing, is happens. People are concerned about what might happen. But you're right. I think our primary concern at this point should be to focus on our clients and taking care of our communities. And hopefully information will continue to evolve and be shared with everyone, and everyone will be involved in the work that will be continuing to happen around public health in our communities.
Okay. Thank you.
Hi, I'd like to ask a question for Jennifer and Zenobia, if you could address, or if there's anyone on the line right now who might be able to address it. ASTHO and obviously the Nurses Association and Public Health Nurses Association have been working hand in glove with trying to address some of the more natty chronic diseases. And the role of the professional public health nurse in the community can be extremely valuable in convening and establishing those strong relationships that are necessary between social services, public health, and healthcare. Are there any examples out there that would like to just share very briefly about your experience at the state or the local level?
This is Jen.
Okay, Jen.
Sorry, this is Jen Cooper. And are you asking about examples related specifically to prevention and management of chronic disease? Did I hear your question right?
Yes, in particular those that may be addressing it from social determinants of health with a health equity lens.
Okay. And I use this example a lot because I really think it's been so valuable with Million Hearts, and that really is the relationships where I've seen public health nurses, and this has been in quite a few states, Connecticut, Wisconsin, Maryland. I'm thinking off the top of my head that I'm working with now, where the public health nurses, and mostly in the local health department, some state, but they're working with faith community nurses, just because we can see them in clinics in the health department, and it might be inconsistent, and they may not know us, but the faith community nurses really have those relationships with the people in their community, in their own faith community. So it's been really an effective way to maybe have a little bit more of a heart-to-heart talk with them and let these people open up to them a little bit more about what are some of the issues and some of the barriers that they're having. So that trust factor that's there has been really valuable. And they've created some kind of bi-directional referrals between public health, the faith communities back to public health, and then, of course, involve like the providers as well, either in primary care or in the health system. So they're working on that, but really trying to pull that faith community piece in where there's that trust and there's those established relationships in some cases already, so that they can uncover what are some of the barriers, what are some of the inequities that exist there, of why it's hard for people to manage their hypertension. So that's an example I can think of with Million Hearts.
Thanks, Jennifer. We have an email question.
Yep. And before we get that, I just wanted to, and I'll remind you of all this at the end as well, but since we're talking about models and examples now, if anyone has any models and examples of this kind of work, please go ahead and email those to us. I just moved ahead to my contact information. I believe you all should have that as well. Feel free to please email us with any examples of models that you all have in your work, and we can work on getting those up onto the ASTHO website. So thank you for that. I'll remind you of that again in a moment. But now to our question via email. How do the speakers today, that's you, Jennifer and Zenobia, view the emerging community health worker movement and impacts on nursing, or nursing's role in impacting the CHW movement?
That's a great question. This is Zenobia. We have a really strong community health worker movement within my state of Arkansas, and I think that it's going to be a very essential piece of the work that's going to be happening as we continue to promote health equity in local communities because of the reach and influence that these community health workers have in their local communities. Arkansas is a state that has a lot of really rural communities, and it is predominantly rural communities in our state, and we have seen just profound impact using community health workers because they live and work in communities and they speak the language of many of the people that we're trying to reach as we try to address some of the long-standing health inequities in our communities. And so I believe that a collaborative relationship between working relationship between community health workers and public health nurses, a give and get, where the community health workers work with public health nurses to learn, to get information about how to conduct their work, and use public health nurses as sort of a strong resource, and community health workers use public health nurses use community health workers as additional arms and ears and out in the communities to reach individuals can be a very beneficial and mutual relationship.
And Zenobia, this is Jen. I'll just add to that. APHN has a public health policy committee, and one of our areas of focus this year is going to be to look at that community health worker role, just so that we as nurses can understand it better, because it looks very different in different communities in different states and regions. So we're trying to get a handle on, what exactly are they doing out there, so that we can understand it better, explain it to our membership better, and then really look at what the collaboration is between the community health worker and the nurse. I'm in the D.C. metro area, so there's actually a really good model here in Richmond, Virginia. I don't know if anyone is on the line from that area, but the Richmond Health District has a really good collaborative model of public health nurses working in the housing district and then having community health workers there. So the nurses are doing a lot of the assessment and kind of directing the referrals and making sure the connections are made, but the community health workers are actually going out and making the visits, and they're people that actually live in that residential housing district. So they have a really good model there, so we're keeping close with them to see how their work is going and trying to learn more about some of those models where they're working together like that. So you'll see more on our website as we work at that, and we'll be presenting about that at our annual conference in April in San Diego.
Great. Thank you both. And I just wanted to get to another couple of quick comments and questions that we've gotten here in the chat box. So I just wanted to raise those. I think the first one, I believe, is more of a comment. Public health nurses are also involved in MCH, maternal and child health policy and programs that support breastfeeding and help prevent obesity in many states. This is sometimes, but not always, through the WIC program. So it's just another point that's been added. And then our next question, maybe our final question depending on time, so we're only about 5 minutes left, is can the speakers address the role of data to document the outcomes of the models they have shared?
As far as Million Hearts, now, APHN isn't directly involved with this. As we're a partner of ASTHO, but I know that on the teams within the states that are funded for the Learning Collaborative, a lot of them are working on how to connect the database systems between the health system and public health so that there can be a better referral process and sharing that's going on. I was even talking with the Wisconsin team on Friday, and their nurses that are actually faith community nurses that are connected with their community clinics and public health and their health system there are trying to make sure they can all get in and document and share their data so they can refer better. So that's been an effort, kind of an ongoing effort with the Million Hearts Initiative, is data sharing and bidirectional referral through an EPIC system or some sort of database. But I think the outcomes are really important, and one of the things we've been trying to do as APHN is really make sure the teams, especially the nurses, like you said in Chicago, that we're really trying to show our outcomes and what our value is really defining up front what our outcomes are and what they look like and what they're going to be, so that we can, really showcase them when we're done and show that we are making a difference.
And, of course, some of the other models we shared today, they certainly have collected data regarding their work and their outcomes. And we can get, I think a copy of this information is going to be available to the participants as well as the slides, so you can access that information and access those programs directly to get more specialized information.
you have any final questions? Great. All right. Well, if there are no final thoughts, again, I just wanted to flag for you, if you all have any, examples or models of this kind of work with public health nurses in states or localities addressing health equity, to please send them to me at dkirchner@astho.org, and we'll work on getting those up on our website. We appreciate all of your feedback and all of your time here on this webinar today. Please feel free to reach out to us if you have any further questions. And again, this webinar will be available online. And I just also have a special thank you to Zenobia and Jennifer for all of your time today and sharing all of your information and resources. We really appreciate it. It's been a great learning opportunity for all of us.
Thank you, Doug, and thank you, ASTHO, for this opportunity.
You're very welcome. And I just wanted also to let everybody know that we'll be sending you a new website that's recently been launched by the National Council on State Legislators and ASTHO in partnership, funded through a CDC grant, so that we could track some of the scope of practice work that's being done in every state relative to nurse practice acts, community health workers, dental hygienists, and other oral health and primary care practitioners. And it was just launched the last couple of days, so we will be sending everyone on this call the link to that new website. I want to thank everybody on behalf of ASTHO. Please, again, send us your stories. Anytime you are looking for some information or need some help, we would love to work in partnership with the public health nurses in a more creative way. And I thank everyone today, and have a wonderful holiday season.
Thank you.
Thank you.
Bye-bye, everyone.
Bye-bye. Thank you.